Hi, everybody. Tamarah and I are back today to talk about leaking. So before we hit record, I was just talking about how a lot of times people don't necessarily comment when we do these discussions. And sometimes you're like, oh my gosh, nobody's watching it. But I think we both hear people coming in to the clinic saying like, thank you so much for talking about these topics, because nobody really wants to put their hand up and say, I pee my pants since having a baby. But I think it's important to know that like it is a common symptom that you might have after having a baby. And yeah, Tamarah and I, we're going to get together and just talk through what kinds of things we look at as therapists when someone comes in describing leaking, just kind of letting you know a little bit about some of the things that may be causing that, but also some of the things you can do about it. Yeah. When I was thinking about creating something about this topic, I was thinking, oh my gosh, what a big topic. How would we cover that? I mean, there's so many different reasons for leaking. There's different types of leaking. And that's why I wanted Tamarah to come on, because then we could talk back and forth maybe about some of the most common types of leaking. Mm-hmm. Why don't you really quickly, Tamarah, let's talk about the two main types, stress and urge. So why don't you really quickly just kind of describe stress incontinence and what people might be experiencing if they have that type of leaking?
Yeah, so generally when a woman or person comes in to see me for stress urinary incontinence, or something that I would deem as stress urinary incontinence, it is related to the cough, sneeze, jump, run kind of sort of, I guess, symptom presentation. So if you're if you're doing jumping jacks, you're like, ooh, I leaked a little, then for example that would be more your stress urinary incontinence. So usually it comes with some type of load or increase in pressure in your canister. So canister being the whole abdominal wall unit, and then that places pressure on the pelvic floor, and then you end up with leakage. And the leakage can be anywhere from like just a little bit, which you would say, oh, well, actually, I don't really leak, and I hear that a lot, but technically that is still considered leakage because you're not supposed to leak any urine. To like sometimes people can lose full bladder control as well. Mm-hmm. So then the urge incontinence tends to be associated with often I find is associated with frequency, urgency. So it can be just urge, or it can be also frequency. So you can be going to the bathroom a lot, and then, but you get a really strong urge coupled with that increase in frequency and that strong urge, then you're trying to rush to the bathroom and then you don't quite make it. Okay. Totally. And so not necessarily associated with running, jumping, coughing or anything, but sometimes, however, those actions can bring on an urge, and you can actually maintain the bladder control and be trying to get to the bathroom, and then you end up leaking with that strong urge sensation too. So that's sort of the urge. The other one is kind of like the key in the door syndrome. All of a sudden you get home and you're like, oh my gosh, I really have to go. And it's that really strong sense of urgency again. And then you may not make it. And so you leak a little bit, or like I said, sometimes it can be like full bladder leakage.
Totally. And mm-hmm. I think we decided we wanted to make sure that this conversation was tailored to postpartum moms, because we just want to be clear that lots of people leak, sometimes before they have babies, sometimes they're men, sometimes there's kids, but this conversation we're definitely focusing on people or women that have had babies. And so why don't we start with stress incontinence? And maybe I'll just give a quick visual. I always show people and I find that it helps them picture it. But if you think of your bladder sitting inside your pelvic floor, and the pelvic floor kind of acts like a bit of a clamp on the hose. Okay. So, picturing that the pelvic floor has the ability to close. I think most people picture that it's just weakness. Like, oh, my pelvic floor is weak. Therefore there's, it's too floppy. So it can't hold the clamp. Therefore I leak. Mm-hmm. But I think that one of the most common things, and they all come in and they'll say, I'm thinking, let's use an example in mind. Let's say 4 months postpartum, she noticed a bit of leaking ever since she had her baby. It's definitely getting better. It even got to the point where it was almost gone, but then she started doing more exercise after her care provider discharged her. So she started getting back to running and some of her HIIT workouts at home. And she's noticing that she's getting leaking with jumping jacks, skipping, and running, right? Especially, as she progresses in her run. So I always show them first, like I usually blow up a balloon and I show them the pelvic floor is my finger. And, I'll say to them, okay, picture this, that one, you can have a pelvic floor, which you're picturing is this just like kind of like not able to hold anything in, right? It's just totally weak and floppy. But you don't have that happening like all day. Like you're not leaking all day, right? And they'll kind of list the things again that's associated with their leaking. And I kind of described that sometimes what happens that no one expects is that your pelvic floor is actually working harder than it needs to, right? Especially after maybe we have a birth and, those muscles aren't moving very well after having a bit of a trauma during your birth. Plus you're nervous about everything going on down there and you're stressed. And so the pelvic floor is working harder than it needs to all day. And then all of a sudden you add something harder to it, like a jump or a cough or running, and it just doesn't have any reserve left. It gets tired. And so that is kind of weakness because it's tired, but that's what makes it let go. And I think a lot of people, once I explain that, and I'm sure you're the same, is they're like, oh yeah, totally. I'm tight all the time. Like once you explain that often it's from carrying more tension that you need to, that it's not efficient. Right. Mm-hmm. And so wouldn't you say that generally someone comes in with stress incontinence, that's where your head goes first, that it's a fatigue issue, but it's more from, holding on to more tension than it is from true just weakness?
Mm-hmm. I think so. And my other sort of, where I tend to kind of go as well as looking into, okay, how were you prenatally? Did you leak prenatally? Because that's also a potential. Like there's a very high incidence of carryover from the prenatal phase, so growing the baby, to the postpartum phase. So, the research suggests that, like, yes, that is cause and effect. So you can have leakage in the prenatal, and then that can actually increase your risk for it to reoccur in the postpartum. Also, like, what kind of sort of person were they before? So, were you previously a high level athlete, or, did you do a lot of CrossFit, or you're a runner, or, because a lot of those things also can be a potential sort of reason why they may have some leakage. And then the last thing is like their birth journey. So did it involve anything like forceps or vacuum or any intervention or C-section? Because you can still have leakage post C-section because of that, for example, higher tone pelvic floor. So I guess I kind of think, okay, if, let's say it's a textbook delivery, then I kind of go, okay, well, what else may have potentially dictated this leakage, right? Or the stress urinary incontinence, I should say, specifically.
Yeah, exactly. And I think that maybe if we should elaborate a little bit on like why those activities would make you even think like, oh, maybe they had kind of a higher tone pelvic floor before. And a lot of people, like, that's not a disease. It's just muscles that are like humming at a higher beat. And I think as soon as I describe that to people, it's like, it's just muscle. Like we can change that. But I think that your muscles are just working harder than they need to. And you describe it and they're like, oh, totally. I'm a type A. I'm always tight everywhere. I thought I was supposed to hold it tight there all the time. And I think also too, like just understanding that some of the sports that you do require a lot of power or require a lot of tension, and tension can be very good, and power and strength are very good. It's just if that's all you're kind of reinforcing, it might feel like it needs a bit of a break too when you're not necessarily in those activities. And so
and it can be pressure induced as well, because like you have to think, as a new mom, you're carrying your baby around a lot. You're also breastfeeding, well, if you are breastfeeding, but regardless of whether you're breastfeeding or bottle feeding, you are bent over, and then you're bent over changing diapers. And I mean, if you have other little ones at home, you're carrying them around or trying to maneuver them around. And then of course you've got like the lifting of all the gear at the same time. So, the pressure canister sometimes, especially initially postpartum, can only manage so much because you just grew a baby, and then your abdominal wall doesn't just automatically go back to normal. Yes, it can function wonderfully, but sometimes that system just needs a little bit of assistance in getting back on board as well, and sort of retraining the breathing, and also like some mobilization and offloading strategies for your upper body, because that is a huge component that can facilitate the pressure.
Totally. And I think kind of like in summary, like if we were thinking of that 4-month postpartum mom again, like those are the things that we would look at. If she came in and said, this is when I'm leaking, first of all, I'd be kind of like taking note of, okay, these are the times she said she's leaking. So I'd want to kind of, educate her a little bit on like, what does it feel like for that pelvic floor muscle to be tight and like closing the urethra versus what does it feel like to like let it off, and make sure that she kind of has all that motion, that her muscle is even able to move through all of the motion that it needs to. And then she can start to figure out like, what am I doing when I leak? Oh my gosh, I'm actually holding it tight all day long. No wonder kind of it's fatiguing when I leak. And like you said, what are my strategies when I go to lift something? Am I creating a lot of pressure that the pelvic floor can't withstand? So, those are things we kind of be sussing out. But then things like you kind of talked about, how are you positioning? Because maybe how you're sitting and how you're standing for the majority of your day is also something contributing to that. How, like, what do you look like when you stand up? Because what you look like when you stand up kind of dictates how well the pelvic floor can work. So, are your glutes really not contribute? Like maybe your glutes are really sluggish too, or, you're clenching them all the time, which doesn't allow good function of the pelvic floor. So I think what we're trying to say is there's so many different reasons and so many different pieces to the puzzle. And it's not for, our point is not, you're never going to get on top of this because it's such a big deal, but there's so many little things like just with your day-to-day habits that you can change that might make a very positive influence on your leaking. I see a lot of times, I often send them home with just understanding how does this group of muscles even work? How can I be more aware? And a lot of times they come back like, oh my gosh, my leaking's gone down by 50%. And all I've done is breathe and think about how I stand or whatever. Yeah. And so I think that, like you said, there's so many things that, we would consider on an individual basis. And anything else kind of big take homes about stress incontinence?
I just think the main thing is that really is that like there's no recipe approach either, and that it really is sort of dialed into the individual. And because you're not going to have the same birth story or the same history or anything as the next person. So I think that, it's not like you can just go, okay, I just need to do some more quickums or speedums or like whatever to, improve the function of the pelvic floor to then impact the continence, right?
Totally. But I do think it's important though, like in that postpartum phase, like even though every woman's unique, I think that we need to be considering like what happens to the body during pregnancy and birth, whether it be C-section or vaginal birth, and just understand that the muscles that are in kind of in charge of keeping us dry have gone through a lot. And so just learning, just giving them some attention. I think all women postpartum should be thinking about that, and then absolutely individualized approach for sure. Should we talk about urge incontinence? And like you said, the difference would be more that these people are leaking not so much with like jump, cough, sneeze, lift, but more with, I have to go so bad and I can't control it. What about, let's say we have, what do you think? Let's say like, I find a little bit moving down maybe 8 months, let's say 8 months postpartum. And they are coming in because their bladder is ruling their life. Like I am always going to the bathroom. My husband says I have such a small bladder. And I really notice it when I'm pulling into the house and I go to get out of the car. And as soon as I go back to get my baby's car seat, I can't hold it anymore.
Yeah.
And like lots comes out. Okay.
Yeah.
So go ahead.
I think, a couple things, because at 8 months, it may be related to a number of different things that can also be driving it. But some of it also comes down to, you know, when you end up having something that's kind of repetitive in your life, you get very conscious of it, and then it starts to become like more reactive, right? So, you know, oh, I have to pee, and then, oh, maybe I should pee before I go, because then I know that if I don't and I get there, then I'll have to pee, or I might not make it. So a lot of these things come to the forefront of the brain as well with respect to the urge incontinence. And it may only just start out as maybe frequency or even just urgency, and then that can lead to some of the incontinence that is like, I guess, follows the urge sensation. And so I think some of it then has to be thought of as like also retraining the brain and the bladder as well. Obviously, you know, whole body treatment and pelvic floor related stuff is definitely going to play a role, but so is the brain at this point as well. So it's learning to dampen that response, learning to trust in your body and your pelvic floor, that you know, you're going to be able to counter that with some, you know, training or whatever it takes to kind of start to improve it, because sometimes it takes a while to improve that response. Because, you know, you pick up your baby car seat, well, there's a load involved there too. And of course, you know, so does the urge incontinence happen then with a load, or does it happen? So you could be sitting as well, and you could be like, oh my gosh, I really have to pee all of a sudden. And you could actually get up and leak. So is it with something like that, or is it just like you key in the front door and then all of a sudden you're like, oh my gosh, I have to go, and then you can't manage it? Or is it, you know, getting out of the car, you feel like you have to go, you lift the baby car seat, and then you leak a little. So it, like, again, you have said, it really depends on the individual's sort of story when they leak and when they experience it with the urgency message.
And because I'm such a visual person, I always describe to people, like, a lot of the pelvic floor activity, like I always think of it working on a dial, right? Like 0 to 10. I always use the number 0 to 10 for people, and describe that as the bladder fills up and has more and more pressure above the pelvic floor has to amp up its number on that dial, because there's more above it that makes it close harder. But one of the things that happens is that sometimes we like don't have the ability, as this fills. One, if you're holding a lot of tension down here all the time, you can't trust it. You can't trust it to go up any higher because it's so tired. And so you'll start getting like leaks, or or even not even just drips, but like voids, right? And so that's one thing, like you talked about, is like, you need to be able to have the trust in this. You need to be able to understand your body and know that, you know what, it's okay if my bladder fills. I have the capacity to be able to like work harder and harder until like my brain tells me that it's time to go. So I think that that's one thing, is understanding, again, knowing how to feel the difference between a relaxed pelvic floor, a really engaged pelvic floor, and kind of knowing what's appropriate. But then also too, like you said, sometimes, like I think of it as like a measuring cup, and there is a capacity that our bladder is able to hold, but a lot of times we start emptying when the bladder's only this full. And what happens is that the brain gets really, really used to dumping and dumping and dumping more often. So again, you kind of lose the trust in the system, and it creates like an overactivity, which is where when you say frequency, like people start going all the time because they're not used to it. Plus, so it's become a small bladder. Like it's very likely not anatomically small. It's just behaving small, but you kind of get used to dumping it small. And again, you can't trust this. So like, that's what, like, I always think of it, I describe them as like, we need to establish the trust, but you also have to start seeing what your habits are. And that's where I think you'll often hear therapists sending their clients home with a bladder diary, like start keeping track of what your habits are. So you can see, oh my gosh, I am always going to the bathroom at home. And you'll hear a lot of people say, like, when I'm out and about, I don't even think about it. Or when I'm at work, I don't go near as much as I do at home.
Yeah.
Whereas at home, you have like a trigger, like you mentioned, like the key in the door, or getting the baby out of the car seat, or sometimes it's a certain toilet for people in their house. Like if you really ask them, they're like, when I go by that toilet, I feel like I have to go, or whatever. And so I think a lot of it, again, is individual, as in, when are you leaking? How much are you leaking? What does your day look like? And what are your behaviors like? And can you trust the pelvic floor? And I always use an example. After I had my second, I had lots of pelvic floor trauma. Like I had an episiotomy, I had tearing, and I had lots of swelling, to the point where when I went pee, I didn't feel comfortable wiping. I'd go into the shower to clean myself because or I would use my peri bottle. I just couldn't wipe. So I got so used to peeing in the shower because I just couldn't, I was so uncomfortable on the toilet. And so I trained my brain to pee in the shower for a long time, but before I realized, oh my God, like I am totally linking the shower to peeing. Like, so it got to the point where my perineum was recovered. And every time I either had a bath or a shower or even went into a pool, I just felt like an urge. And I knew I wasn't full. I had just peed before I got in the pool. And I thought, oh my gosh, I've totally trained my brain to associate water with peeing. And so again, it's super powerful. And I just had to get to the point where, when I was in the shower, instead of like responding to that urge, I would often just distract it. Like, no, I have to shampoo my hair right now. It's not a time to go pee. And it's gone, obviously. But yeah, so like a big behavioral component with that.
Yeah, exactly.
Yeah. So I think that at the end of the day, we just want you to most get out of this, that it is really common after having a baby to feel like you don't have great control of your bladder. It's really normal in the early postpartum phase because of the trauma and the stretch that the pelvic floor goes through during a birth. It should get better with time. Time will help, but sometimes time's not enough. Sometimes it's habits that we get into. Sometimes it's a combination of all the things going on in our body that kind of make the pelvic floor at a disadvantage. And so there's lots of different things that we would look at with your individual situation. But pelvic floor physio has been shown to be very effective with treating incontinence. And so it's not something that you need to live with. And so, at the end of the day, the point is not, oh my gosh, you'll never get over this because there's too many things to think about. It's like, the body is so cool and it's very adaptable and it's very resilient. And there's some small things that you can change that can make a really big difference.
Absolutely.
Yeah. So, I think we both made the point that going to see someone in person is a really good idea. And so, we'll both link our information now. You can get in touch with us both in person or through online appointment. And I always suggest to people the Mommy Berries postpartum program, because it's a really good place to start after you have a baby, with just kind of getting in touch with those muscles again and giving their best chance to recover before you go to see someone in person. So I will link that at the bottom too. Thank you so much, Tamarah.
Thanks.
It was a pleasure.
Thanks.
Bye, everybody.
Bye.